Chitangala. As at May 2020, and nearly the entire world was under lockdown due to the fight against the coronavirus. Whole sections of the economy have effectively been put on pause. As at 31st March 2020, we had 750,890 confirmed cases and 36,405 deaths. And by 21st May, which was yesterday, we had 5.1 million confirmed cases and 332,862 deaths. What a jump within just less than 2 months. Given the limited testing capacity that most countries face, this definitely is a gross underestimation of cases. In Africa alone, 100,000 confirmed cases as of yesterday and more than 3,000 deaths. When coronavirus disease 2019 started hitting Lombardy, the most affected region in Italy, it had a little over 700 intensive care unit beds for its 10.4 million people. The USA currently predicts under a moderate outbreak that they will need more than 200,000 ICU beds. By comparison, the number of ICU beds is 55 in Uganda, a country with a population of 42 million people. The situation regarding ventilators, which are required to keep people on life support, is even stagger. Countries like Mali, Burkina Faso, Liberia, I'm not sure whether I should include Zambia here, have got less than 20 ventilators each. Can Africa's already weak health systems handle this rapid increase? To help me answer this and many other questions on the economic impact of COVID-19 at household level, I have Dr. Peter Hangoma from the University of Zambia. Doc, welcome to the program.
Thank you so much, Dr. Chitangala. Is it morning?
It's still morning.
Yes.
A few minutes from now will be in the afternoon. Now, Doc, just tell us a bit about, it's the first time I'm having you on the program, just tell us a bit about yourself.
Okay. Maybe you want me to remove my mask?
I think you are safe. This is more than a minute and a half already.
All right. Okay, thank you so much. Okay. My name is Peter Hangoma. I am an economist at the University of Zambia.
Mm-hmm.
I work at the Department of Economics and the Department of Health Policy and Management,
Mm-hmm.
which I head.
Yes.
I'm also a consultant for various organizations, the World Health Organization, USAID, and I also work for the Christian Marcosson Institute in Norway. And I work on a lot of things. One of the things that I'm working on currently is to help governments, like the government of Ethiopia,
Mm-hmm.
on their coronavirus pandemic.
Wonderful. We have featured quite a lot of big brains on this program. We are honored that we have added another one today.
Thank you so much.
Thank you so much. This program is live on Prism Africa TV and, of course, Litovia TV, if you may want to say so. And we're also live on Facebook. And please like my page, Freddy Chitangala Zone. And you can also find us on YouTube. You are going to have a chance to call or text on the number that you'll be seeing on your screen. We want to hear from you. Ask the doctor here a question on what you think coronavirus is having or has an impact on you and your household, even on your job. Some of you, like me, we are working from home. Perhaps you are not even working because your office is closed, as there could be no business. Now, Doc, across Africa, there are approximately 1.2 hospital beds per 1,000 people, okay? Could this mean mortality from COVID-19 under similar transmission rates could even be higher in Africa as people cannot access the required initial care?
Okay, thank you so much for that very important question. I think, of course, Africa has a challenged health system, as
Mm-hmm.
you have rightly put it. Less ICU beds, no enough ventilators,
Mm-hmm.
and health workers. When you look at the ratio of nurses per 1,000 population, doctors per 1,000 population, it's small.
Mm-hmm.
So if you have a generalized pandemic, the way it has hit Europe and the US, then you expect problems in Africa. And of course, there is no reason why we should think that Africa will have less problems, because we are also human.
Yeah.
So even when people were saying that we expect problems in Africa, because they knew that Africans are also human and they may have big problems. But of course, one thing that we have to understand is that conditions are different. So it's about the severity of the disease.
Yeah.
So right now, the emerging evidence suggests that COVID-19 may not be as severe in Africa as it has been in other countries. First of all, it's because of demographics. So we know that COVID-19 affects the people who are mostly at risk are those who are elderly or over 50, 60 years old, and those who have chronic conditions. Already we know that in Africa, mostly it's a young population. So even when you have the coronavirus, it may not really have that much impact. In terms of sickness, may not be very severe. So in general, we expect a situation where, unless we become careless, but we don't expect a situation where the African health system will be overwhelmed, because the demographics are different. There's also evidence that the weather, you know, coronavirus, it's a fat. It's not like a living thing. It's a fat. So when it's exposed to high temperatures, it melts. Of course, we know that right now we are moving into winter in most parts, but still there is evidence that in climates such as Africa, it may not be as bad. There is also evidence that in areas where malaria is very prominent, coronavirus may not be as severe. So we have a situation where in most parts of Africa, there's a lot of malaria, and there's evidence pointing to a correlation.
Sorry, Doc, is that a theory or an assumption, or it is evidence-based?
So that one is correlation. So it's not yet, there are no lab studies that have been conducted to see whether malaria, but what has been shown, if you look at the maps, there's been, wherever malaria is more prominent, coronavirus is less likely. So we do not know, of course, this calls for more research. We do not know whether it's the drugs related to malaria or it's malaria itself. Maybe the body builds that mechanism, the immunity that fights malaria is so effective that when corona comes, it's easy for it to fight. We don't know. All those are hypotheses. So it's hypotheses, not strong evidence yet, but it's just correlations to show that where there is more malaria, there is less corona.
Yeah. So you're saying that because of predominantly, we have an expansive kind of population pyramid, very broad on the base and very narrow on top, meaning, as you've rightly put it, Doc, that we have a lot more young people than older people.
Yes.
Could we then be right to say that perhaps the numbers we're seeing right now are way, way more than the real or the reality out there? We could have so many young people living with coronavirus, or who have been exposed to coronavirus, but they haven't shown any kind of sickness.
That's it. That's a fact. Actually, there's one time I shared estimates of how we project the coronavirus to evolve. And we know that, of course, what happens is that when you report the number of cases, you are, because of limited testing capacity, so you are potentially underestimating by not less than 10 times. So if you have any number, let's say you have 1,000 cases, you have to multiply that by 10 to get the true number of cases. But for our context, it's actually, because, you know, in other countries, they do like 100,000 tests. And then we are able to do only a few hundreds. So it's a lot of people that we are not picking up who have corona. Now we know better about corona. Those days, it was, you know, it was a big scare. When we hear that you get corona, then it's a death sentence. Right now, we know that it's a mild disease. But it's only a mild disease to the young people and to those who don't have chronic conditions. Those who are older, it's not supposed to be a mild disease. Those are the ones that will need ICU beds, who need ventilators. And those with chronic conditions such as, you know, asthma, diabetes, high blood pressure. So that's really what we know. So we know that there is more corona out there than we have reported. That's
interesting. Africa, there's one more, I don't know if it's a demographic issue. There's one more issue in Africa that people seem to be using as an excuse why you are not seeing so many deaths. There are too many people that have HIV, living with HIV, and they're taking ARVs. Some people assumed that acts or treatment of HIV using ARVs could actually help somebody who is exposed to coronavirus. Do you think this is one of those giving us protection, especially that one of the ARVs right now is being tested to help prevent against coronavirus?
It's because, you know, the different HIV ARVs have different functions.
That's right.
So the one that is being tested and the one that has been approved, for example, in the US, is not really this first-line treatment, for example, in Zambia and all that. So they're different drugs. But at least, so we cannot really tell whether it's ART treatment that may help. But one thing that we know is that from evidence in South Africa, we have not seen more mortality, because at first we were thinking that really because of HIV/AIDS, people are going to die more. So we were thinking that really it's about old age, chronic conditions, but also HIV/AIDS.
Yeah.
But when the coronavirus, we know that in South Africa there's a lot of coronavirus than any other country in Africa. But we haven't seen higher mortality. The South African health system is not overwhelmed. Of course, somebody may say they locked down, but still they have, as of today, I think it's about 19,137 cases. And of those 19,137 cases, only 369 have died, which is far less than 2% or something.
Yeah.
You see? So meaning that even if the South Africa has one of the highest HIV prevalence in the world, it has not really experienced that devastating death rates from corona as Europe has experienced and the US. Of course, what is there is that, you know, we cannot make definitive conclusions right now because it's not yet over. The coronavirus is still there.
Absolutely.
Yes. So, but what we know is that the progression of coronavirus has not been as fast in Africa as it was in China, as it was in Europe, as it was in the US. And it has really sent a lot of people there. Everyone is surprised. For me, the first time when we just recorded, I think, one case or so, I wrote an article where I said Africa may escape this or they may experience few cases. I published that article in Europe and I was attacked. I was attacked that you are spreading dangerous messages to policymakers because they will relax. The things may, you know. But for me, I had looked at the dynamics of Africa. I had looked at, for example, the level of how many cases we have planted. Because, you know, the cases that you plant in the community will also determine how fast you are going to grow the coronavirus. And the cases that you plant in the community are dependent on the level of travel, for example. We don't travel as much. For example, in Johannesburg, there were thousands of flights per day. In Zambia, you have, if there is a lot of flights, it will be 3. Yes. So, you know, you haven't planted too much coronavirus. So I knew that the progression will be slow, and if the progression is slow, then it gives chance to policymakers to interrupt the transmission. So I had anticipated even from that time that the coronavirus pandemic may not be as severe as other countries.
It reminds me of, I was in Sydney in the first week of, well, from January to the first week of February. By then, coronavirus was just becoming a big news item on most international media. And a friend of mine asked me, Fred, do you think Africa is ready to handle coronavirus? I had no idea very little was published about coronavirus that early, but I told him one thing, and I don't know whether I'm still correct or not. Very close to what you have said. I told him one thing: Africa has handled so much. Africa has been through so much that most of you out there have never been.
Yeah.
I don't expect as much impact as we are seeing in China right now. So he laughed, and we went on to other stories. So
that was nice. Yes. Yeah, exactly. So, you know, when you are exposed to a lot of environmental insults, you know, you build that form of even the immune system is on guard.
Yeah.
To receive anything that it should fight and all that. But the most important thing, I think, also is that African policymakers have handled a lot of pandemics. So somehow, when you look at preparedness, we may be poor, but in terms of preparedness on how to handle pandemics, we are not that bad after all.
Yeah.
And that's why you saw that even when things, our policymakers didn't delay to put in measures to contain this, that's why you've seen the slow progression. So what is important for, now to get back to your question, in order for our health systems not to be overwhelmed, it's about making sure, I've always said, and I commented, the president has been really good in terms of updating us on his Facebook page on the coronavirus and all that, and he has advocated for this new normal. And I commented on his Facebook page and I said, thank you so much, Your Excellency, but what we should be able to make sure is that we should have intermittent and strategic lockdowns over time, not really a complete lockdown, because we don't want people to suffer. So there will be times when you see that there is a risk that is arising somewhere, you can say, okay, I think there's a risk in Akonde. Lock it down for a little bit. For a little bit, do the rapid, proper testing, isolate the people that have to, and then after some time, let people look for food. Let people do other things. That's really, and that's how, if you look at West Africa, that's how they handled the Ebola crisis. In West Africa, when you look at Liberia, Sierra Leone, Guinea, they didn't lock down for an indefinite period. They would have, they would lock down 3 days. They would lock down Conakry for 3 days, and then when they do the massive testing, isolate and all that, and then move on just like that until they eliminated the pandemic.
Absolutely.
Yeah.
So we are, just to clarify to that viewer out there who thinks we are safe, we are not saying just because we are not as vulnerable as the Western community, then we should be too reluctant. We're not saying that, right?
We are not saying that. In fact, what we are saying, when we talk about the new normal, and this I've emphasized every time, when we talk about the new normal, in order for us to, if we want to boast, I know that most people want to boast that Africa has not been affected. If you want to successfully boast, then you must make sure that you take even more precautions right now. It means that you need to make sure that the social distancing is, you observe social distancing, sanitizing your hands, washing with soap, your masks and all that. Make sure that you keep all those religiously. If you do that, then it is possible that we will stay low just like that, and you'll be able to boast, and it will be nice for Africa to stand and say we managed to contain this pandemic. So when we say the new normal, what we are saying is that let's not go back to the way we used to live. It's called a new normal. It's not the normal, it's the new normal. The new normal is about social distancing, cleanliness, and really masks and all those things.
Let me take this call and see if we have a caller. You are through to coronavirus, and thank you so much. Somebody has hung up. Please try to call again. Perhaps you can get through and ask Dr. Hangoma a question or make a contribution on the program. Now, Doc, let's get down to how economies and livelihoods are being threatened or impacted. In an attempt to flatten the curve of transmissions, many countries have effectively stopped people from moving and interacting. What's the potential economic effect of this move on household income, especially for countries whose majority population depends on hand-to-mouth kind of situations?
Yeah. So we have said it time and again that the coronavirus is going to, if we are not careful, the effect that the coronavirus will have will be less than the measures against it. So the lockdowns, the interventions that are being put, if they are not being put carefully, it may lead to more deaths than the coronavirus itself. And so what we are saying is that coronavirus itself may not really affect people's livelihoods, but we have a situation where the measures against it, such as restricting travel, closing down businesses, they will lead households may not have jobs, And at the end of it, we may have a situation where they won't have food to eat.
Yeah.
They won't have, if you know that if they don't have food to eat, you know, most households in Africa, they depend on hand to mouth. So if they do not have food to eat, then we are talking about starvation in their homes. You know, this mother who has 5 children, and she goes to the market every day to sell in order to buy a small meal for that day. And then you say, okay, nothing for the next, say, 1 week. Mm-hmm. You can imagine what children will be eating, all those 5 children, what they'll be eating for that. So what you are inviting is malnutrition. And malnutrition, we already know that malnutrition is killing a lot of children. Yeah. So malnutrition, then we'll have more deaths from malnutrition. We will have more deaths from other related conditions than coronavirus itself. So that's the fear that we have over these lockdowns. So what has to happen is a strategic balance, and that's why we talk about these intermittent and strategic lockdowns. Yeah. Because if you just get I've always said those people who advocate for lockdowns just like that are those who have the privilege of lockdowns. Those who maybe like me, they know that even if they stay home, they'll get a salary at the end of the month. They know that even if they stay home, they have food already. They have everything. So it's the privilege. Lockdowns are a privilege of the privileged. That's what we can say. Because an ordinary Zambian, for example, cannot afford a lockdown. So what has to happen if we have to do lockdowns? What has happened? You know, that's why we may not be able to copy what others do. Even places where they've implemented, those people are rich people, mostly in Europe and in the US. But yet, even with those lockdowns, governments have prepared transfers. They've given households money to survive. So if a country like Zambia, we are hit by this coronavirus, then we need to be careful in terms of how we lock down. Because this coronavirus, the measures, in fact, I'm distinguishing 2 things. Coronavirus, the effect of coronavirus, and the effect of measures against coronavirus. And what we are saying is that the measures against coronavirus can affect households' consumption, nutrition status, and you know, a lot of livelihoods can be lost as a result of those measures.
Absolutely. There's something just coming to my mind. A very important observation I've made since this coronavirus, especially since the mid-May, when we got hit with the first 2 cases. Personally, I had a pending appointment at a big hospital to see a doctor for my eyes, and I was told that appointment has been cancelled. Because they are scared of coronavirus. It's a hospital. I had another appointment at a private hospital. I was told the same. And then I'm wondering, this coronavirus, the effects, the measures, maybe we are overdoing some of these things. Why should a hospital cancel appointments for other health issues just because of they are scared of coronavirus? Where do I go? If I have high blood pressure? Where do I go if I've got eye problems? Where do I go if I've got malaria? Because my doctors are saying, we can't attend to you because you can bring coronavirus here. Now, on the economic impact of such a move, how do you think health facilities, private and public, maybe mostly private, are making that money when a situation like this happens?
So, of course, it's a challenge. First of all, when you talk about other studies have demonstrated that when you have a pandemic, like people would also be scared to go to health facilities. What you see then is a rise. Are you seeing that? So there is that now, all-cause mortality increases. That's why in other countries, for example, in Ethiopia, cognizant of this problem, what they've formed 2 task forces. A task force that has to protect, that responds to coronavirus, and a task force that protects what is called the essential package of health services. So essential package, every country has an essential package of health services that need to be protected. Maternal, deliveries, you know, malaria, tuberculosis, and all those things. Those need to be protected. But if you have a pandemic like this one, then people Ethiopia has done is to have this task force that makes sure that they protect this essential package of food. And we've already run estimates on how, for example, tuberculosis affects the economy. In terms of productivity losses, you know, there are a lot of people who, when they get malaria, the tuberculosis, 6 months, somebody cannot really be productive as they are supposed to be, and productivity suffers. You can imagine this person runs a company where 15 households depend on their income from this, and then they get tuberculosis. People's livelihoods are shattered. So that's why we talk about protecting the other services.
Sorry, Doc. Let me try to get this call, and maybe we can get through. Thank you again. Try to call again if you can. I hope these are not Dr. Bihai's phone calls coming in, but in whatever the case, please have a chance to call us on the number on your screen. You can ask the doctor here any question regarding what we are discussing today, or you can make a contribution. Especially we want to hear, how is coronavirus affecting you as a household, affecting you in any negative way? We want to hear under the comment section. In fact, Doc, she did mention that his clients called them and said, we can't come to your facility anymore because we are scared of coronavirus. Exactly. So, hospitals are associated with the measures and from other causes just because of what we are doing. And sometimes it's because of lack of understanding of the situation.
Yes, so it's the job of the policymakers to find ways of feeding the people the correct information. You know, whether the information that you give out will be received or not depends on whether they trust you or not. Governments can recognize that sometimes people don't trust them. So there is need for government to find mechanisms of spreading this information, and they can use community agents, for example, people to spread the messages. They can use other technical bodies, such as, instead of, for example, the government itself or the ministry saying coronavirus is dangerous. They could delegate that to community agents. Even, let's say in villages, they could delegate that responsibility to the chiefs, to the headmen. They can delegate that responsibility to universities, because people will think, oh, these are people who are, some people will trust them because they think, oh, these are technical. They can, so the issue of trust is very important. And people have to understand that, okay, don't just tell them. If you give them false information, for example, they knew from the onset that coronavirus is dangerous. And then they see people dancing. And then they're like, so they were lying to us all this time.
Part after party.
Yes. So they start thinking, they were lying to us. You saw that video that surfaced where coronavirus patients were dancing.
Yes.
You see? So people now are thinking, oh, so they were lying to us. But if you spread correct information to say, you know what, this disease is mild in most cases, but there is a non-zero chance of you dying if you have these conditions, you have these conditions. So you have to take care, not because of yourself, but because of your neighbor. Your neighbor may have diabetes. Your neighbor may be old. So that information needs to be spread in a very correct way.
Absolutely. So we tested you, we found you positive. You are not sick, you are very healthy, but we have to keep you away so that you protect
others,
the old people, those who have other conditions. And so you can dance in the isolation if you want.
And it has to be clear. And as policymakers, we shouldn't be saying
why females and males were found in the same word.
The economic impact of the coronavirus. We are looking at impact on food security. There is impact on what we call prices. So as a result of these measures, which disrupts the supply chain, people are not able to move products properly. You would find that maybe prices of rice go up, or prices of these other things, cooking oil, they go up. It's really because, so prices may be affected, and people with a fixed income, because their salaries are not increasing and they're not making any more money. So you'll find that if they were earning 200 kwacha per month, and then they were buying cooking oil for 2.5 liters for 50 kwacha, which can last them the whole month, now they have to buy 150 kwacha. The same amount, cooking oil.
Absolutely.
So from their monthly salary, now they are remaining with 50 kwacha. Previously, they were able to buy midi meal and cooking oil from that salary. Now they can only buy cooking oil from the salary. So that's how prices, these restrictions on movements and all that, they affect prices. So even if the things are available, even if people can have produced this mealie meal, they've produced the rice, but they are not able to get them to the market where people can access them. So they become rare and the prices go up.
Yeah.
So we know, of course, that this coronavirus has hit us at the time when the harvests have already happened. So production, on the production side itself, it hasn't been hit. So we have produced. If you look at the numbers from the Food and Agriculture Organization,
why are the
still
pricings going up?
Because of what I mean now, the supply chain has been disrupted. You know, when we talk about price, for us economics, we talk about demand and supply.
Yeah.
So supply has been constrained. Are you seeing that? So when there's less supply, but the demand has remained the same, people still need to eat, but supply has reduced, not because there's no production, but because suppliers cannot get the things to the market. For example, somebody was telling me that, no, Nakonde rice now, you know, we used to buy Nakonde rice for a meda, we used to buy 60 kwacha in Soweto, now we are buying at 120 kwacha.
Absolutely.
I said yes, because now, especially, for example, now we have these restrictions on things from Nakonde and all that. So we have a challenge. So prices can really affect household livelihoods. They can, it's like taking away their jobs. So it's not just people losing the jobs. That's where now the Consumer and Protection Commission has to come in to make sure that they protect consumers in terms of exploitative business practices. So that's very important. But also, we are now, very soon we'll be moving to the agricultural season. Agriculture season is approaching where big farmers or farmers may not be able to access production up. And it will we are saying we've already harvested this time. So production hasn't been affected. To be careful and to put in place systems, distribution systems, for several months, that would drive the cost of bringing that fertilizer. The cost of fertilizer will be up. So if the budget of this farmer was to buy 20 bags of fertilizer, because now the fertilizer has become more expensive, they will buy 7 bags of fertilizer. And now because they've bought 7 bags of fertilizer, they will plant less. And now because they've planted less, we would expect price of mealie meal then to shoot up next year.
Yeah.
And we know what happens.
Oh my goodness.
Yeah.
This is Coronavirus and You, and today we are discussing the actual impact, economic impact of COVID-19 on the household. And these are very interesting, and also tell us how this, when we had the first 2 cases, perhaps then the next few, I saw people running from shop to shop, ordering hand sanitizers so that they can keep and sell afterwards when the prices go up. Okay, I don't know if that is happening now because production was ramped up and supply was ramped up as well. So we have too many now hand sanitizers. But what I'm trying to ask here is, could there be an economic activity from a point of view of anybody, even an individual, even in times of...
That's a very good question. Actually, they say that when you have a crisis, that's where millionaires are made. But that's where, so inequalities split doom. So it's happened, for example, today. Ethiopian Airlines, of course I'm talking about Ethiopia because I'm working a lot in there.
Yeah.
So, but really, Ethiopian Airlines right now, more than any other airline in the world, I think it's the only airline that hasn't reduced capacity as much. And you know what they did? They changed their planes. So they saw that, okay, passenger travel is going to reduce. So they got, I think, about more than 20 of their planes, changed them from passenger plane to cargo planes. And what they did was to reduce prices of cargo transport. And after that, right now we are talking about, they again seized an opportunity. In Europe, when, let's say, Latin American countries are ordering ventilators, they are grabbed in Europe and the US. They grab, the authorities grab them for whatever reason. But so those Ethiopian Airlines has gone to those countries in Latin America to say, you can transit via Addis. And so now countries like Brazil are transiting via Addis, ventilators and all those. So they are, while traffic for many airlines, including big airlines that you know, has dropped by 80%. Ethiopian Airlines, it has only dropped by about 30 to 40%.
And basically, that drop is on the passenger transportation.
Passenger transport. Yeah. So the passenger transport, even for them, dropped up to maybe 80%. It had gone to 20%. But what they did, they converted the planes, started transporting cargo. So their profits, when you hear their end of year profits, if you hear losses, you definitely hear losses for many airlines. But Ethiopian Airlines would be a different thing. South African Airlines closed and all that. So it's about seizing opportunities. The same thing here in Zambia. We have things that are not coming anymore from South Africa. People can seize those opportunities. What can we produce to the supermarkets that can be used? For me, I talk about when you have private sector failure. The private sector cannot produce the things, maybe they lack capital and all those things, or entrepreneurship. Even if the Bank of Zambia has reduced the interest rates, but maybe they may not have the, and if I were to advise, I would say that's where the government can come in to seize the opportunity to say, can we jumpstart production in this other thing? If that's why we have the Industrial Development Corporation. Yes. They can look at opportunities and see how best to come in strategically to supply, to take advantage of the opportunity that certain things that were coming from South Africa, they are not coming in, or they are at a high price. So they can produce locally and feed the necessary outlets. Yeah.
For those that are watching this program using the Facebook platform, thank you so much. I have quite a lot of names here. I can't mention everyone, but you know yourselves. Thank you so much for watching this program. And it has become indeed a household program every Friday at 11:30. Tell your neighbor, share the link so that everyone can be educated on how to protect themselves against COVID-19 and indeed how to seize the opportunity. Now, Doc, let's talk about the education sector. And I'm happy to ask this question because you are from that sector mainly. Let's be specific about this. We know that schools have been closed, including universities. What opportunity is there for a university, for instance, in this period to deliver learning content to the learners, still earn an income from the learners, and without delaying the progression rate of the learners?
Yes, I think this is, and I think I'm happy that most universities have really exploited that opportunity. This is, in this technologically advanced world, we have a situation where universities especially can go to online platforms and really invest a lot in online platforms, but making sure that those online platforms that they are using are as real as possible. I have seen that. I've seen in most universities, they have made online platforms to be very interactive, such that even when the student is interacting with the system, they see very little difference between actually attending class and attending that online platform. It's the same thing with video conferencing, the way we've seen it. So we've seen, for example, Zoom coming up and shooting up. It's really because Skype was okay, but it wasn't as, close to reality. And then people have realized, oh, actually with Zoom, you can have a meeting that looks like it's real, and with so many people. So that's why now you have online platforms of learning such as Moodle and many other platforms. But really it's about, the problem is that those platforms require a lot of investment in the initial phase. So you need to invest a lot, first of all, in buying the licenses, and then in setting them up. Once you lecture notes, but it's also about that investment. In funding, they depend on government with this online platform. But of course, if board is moving to a situation where monetary policy rate has been reduced, we'll take risks for private universities and others to take up loans and invest in this infrastructure for a longer period. I think that's really the opportunity that I see, because people have to continue learning in hundreds of years and all that going forward.
You a few minutes ago, you did mention that we see the production of farming output to reduce next year, not this season,
Yeah.
but next year, due to the disturbance in the supply chain of imports. About farming seriously, especially now.
What I would say is do what you do best.
Yeah.
So, for example, if a person like me spends 1 week trying to do farming, it may not buy 5 times what I would have farmed. But of course, for those who are into farming, for those, you know, the problem in Zambia is that we copy. When we hear somebody says, "Oh, I'm doing tomato farming," you want to do onions.
Yeah.
You've forgotten that for you, you have, we call it comparative advantage as who stockpiles. Stock was saying, no, I think President Obama didn't do a lot in stockpiling, the masks and all those things, PPE equipment. So stockpiling the necessary inputs while
the program, but during this,
the fiscal capacity, that Ministry of Community Development and all those places to distribute. Even in Zambia right now, that's what
people are casting the household didn't say it because we want to see you there. So because you can stay glued as usual. Your health is your choice. Bye bye.